Keep in mind that when we discuss homeostatic imbalances of a system of the body, we're really just discussing disorders. So there are two major, there's actually many disorders that can take place in the skin, but the two major ones that we'll be discussing are skin cancer and burns. So let's start off with skin cancer. Just so you know, just so we're all on the same page, cancer is defined as an overgrowth of cells. In every type of cancer, whether it's an inappropriate cell or whether it's a cell that belongs to a different area of the body that's growing erroneously somewhere else, in any case, cancer is always defined as an overgrowth of cells. Too many cells are proliferating in some kind of a region. The first one that we're going to be looking at here is called basal cell carcinoma. What happens here is that deepest layer of the epidermis called the stratum basale cells start to grow downward and actually invade the dermis. This is the least malignant of the cancers and can readily be surgically removed. Let's see, what else did I want to say? It has a distinctive look that it's rather shiny and has this beaded edge to it. The second one we're going to be looking at is called squamous cell carcinoma. In this case, the culprits are the keratinocytes of the stratum spinosum. Again, it has this kind of appearance of like a scaly, reddish area. Usually this is going to be found in the head and the hands. All right, and then again, surgical removal, especially early in detection, is important. The third type of cancer we're looking at here, the third type of skin cancer, which is the most dangerous, is melanoma. Melanoma makes up about 5% of the skin cancers. It is the hardest to cure. So it is highly metastatic. Metastatic is a word that means it's able to spread through the blood. It is highly metastatic if the region that is infected, that has cancer, is greater than 4 millimeters in diameter. And you can see here, I don't know if you can see it clearly, but this is each of these little tick marks here are millimeters. So you can see that this one's probably about 20 millimeters in diameter. And so this is a very dangerous diagnosis of melanoma, which perhaps was overlooked because of its presence on the big toe. So in this case, it is a problem of an overgrowth of melanocytes themselves. It is highly metastatic. It's easily spreadable. The cures for melanoma include wide surgical incision. In other words, not just removing the tumor itself, but removing a great deal of tissue around that tumor. We're working on, well, the scientific community is working on immunotherapies, which is trying to train the body to fight against the melanoma, the inappropriate melanoma cells. Okay, so that is melanoma. It's oftentimes grown from little spots of melanin. So if a freckle or a mole, which already is, basically little freckles and little moles are already little populations of melanocytes. And what happens is that when the melanocytes start to spread, it can be pretty obvious, especially if you have light skin and darker freckles or darker moles. You start to see this kind of unusual shaping to the cells, or to the area. The last one we're looking at here is called Kaposi sarcoma. Kaposi sarcoma is one of the types of lesions that is shown in especially fairly far advanced cases of AIDS and other immune deficiency disorders. This is actually a viral condition that basically takes advantage of the fact that the body is not fighting off viruses as well as it had before. It's basically very difficult to treat. There are various treatments, but they usually involve surgical removal, and so it's difficult to actually get to the base of the problem and prevent further lesions from taking place. Okay, so those are 4 chief types of skin cancers that you may encounter in future. The next type of disorder that we are going to be looking at, the disorder of the skin, is going to be burns. Burns are tissue damage and cell death that have resulted from intense heat, electricity, radiation, friction, or chemical burns. What we're looking at here is called the rule of nines. The basic idea here is that the body is divided up into roughly 9 percentages in various places. It's important to get the percentage, and I'll talk about why in a moment, but it's important to quickly convey to someone what percentage of a person's body has been burned, and then the type of burn that they have, which I'll talk about also in a moment. So we break it up like this. The front of the arm is 4.5%. The front of each arm is 4.5%. The back of each arm is 4.5%, so that's 9% per arm. The anterior leg, if you look at the full leg, 9%, full leg, 9%, but that's the front only. So if you look at the posterior sides, they're going to be 9% each. So you'll notice that if you add up all of the legs, if you had a burn that covered the entirety of the front and the back of both legs, it would basically be 9% times 4. One for the front, one for the front, one for the back, one for the back. So 9% times 4 is 36%. The perineum itself is 1%, which brings up an interesting case study that I'll try to make time for in class. The anterior trunk is 18%. The posterior trunk is 18%. You notice that makes up 36% of your area of skin. The anterior and posterior head and neck would be 9%, 4.5% to the front, 4.5% to the back. So make sure that you're able to answer questions about, like, if I were to ask you, if this region and this region were both burned, then what percentage would it be? So that you can quickly convey to somebody what percentage of a person's body has been burned, say in the accident as they arrive at the hospital. So everybody has a pretty clear idea of exactly how bad the burn is. So why are we concerned about burns? Well, burns entail a loss of fluids, proteins, electrolytes, low body temperature, you're losing heat, which is inappropriate, and even dehydration. So there's an immediate problem with pain. They say that the burns are one of the worst types of pains you can experience, but also all of these secondary problems. And one of the things is that you have open wounds. So day 2, day 3, you start to experience infections from bacteria, fungi, and pathogens. So not only is it important to convey the percentage, but it's also important to convey the type of burn that you're looking at. On the left-hand side here, we have 2 different types of burns shown. The first one is the first-degree burn, where only the epidermis has been damaged, and generally this shows up like a redness, like a distinctive redness. So like a sunburn, a typical sunburn would be a first-degree burn. A second-degree burn is where the epidermis and the upper part of the dermis is burned. This typically shows itself as a blister. A third-degree burn occurs where the entire thickness of the skin has been burned, the nerve endings have been destroyed, so ironically, there is no pain in those regions. As bad as that burn is, there's no nerve endings, so you don't experience pain. That's one of the characteristics of really bad burns. You can actually have fourth-degree burns where you start to look at muscle damage and bone damage as the result of the burn. So we deal with burn units. When burns are particularly bad, it is suggested that you go to a high-level hospital that has a regulated level of expertise in burn, or a burn unit. So if 25% of your body, again going back to your rule of nines, if 25% of your body was damaged by second-degree burns, then it would be suggested that you get treated at a burn unit where they're going to be watching for things like dehydration, infection, and pain. But if only 10% of your body, 10%, was burned by a third-degree burn or worse, then it is suggested that treatment at a burn center would be the most appropriate way of going forward. Oh, and first, second, and third-degree burns are considered also superficial burns, partial thickness burns, and full thickness burns. It just really depends on the textbook and the clinic.